So welcome everyone to another in the series of webinars that we're hosting that really are designed to tell you more and more detail about the portfolio of tech companies that we have through our investment in Shore Valley Ventures. I'm here today with Barry Downs, who's the managing partner at Shore Valley Ventures, and Anita Finnegan, who is the CEO and founder of Leah. So Anita, would you like to tell us a bit about Leah?
All right, Nick, thank you. So Leah is a world leader in the provision of cybersecurity solutions for connected medical devices and also healthcare providers. So a little bit about our background. We're actually a spin-out company from an Irish university, or Dundalk Institute of Technology. That research centre that we spun out is actually an internationally renowned software research centre known as Leah, based in University of Limerick. More specifically, the technology that we have developed, and I'll speak about that in a minute, was a spin-out from my own PhD research. And that research was funded by Science Foundation and Enterprise Ireland. So I'm just going to introduce myself first of all, by way of my bio. I have founded this company. My PhD, as I mentioned, was focused on medical device cybersecurity. I was one of the very first people in the world. There was a handful of people looking at medical device cybersecurity at the time that I began. During that period, I got a lot of traction, a lot of attention from policymakers such as FDA and international standards communities, and that allowed me the opportunity to be able to author some international standards, of which I've listed here. I'm very active in the area around international standards and developing best practices around medical device cybersecurity, and I've worked with a number of communities and working groups in relation to this around the manufacturer disclosure statement, Canvas group. I work with underwriter laboratories in terms of their standards development, and also ISO and IEC, as I mentioned. In addition to that, I do some work here in Europe. I am an NISA expert, and I have worked under some of the EU cybersecurity work, and I'm also an EU Commission expert. So I'm going to introduce now what our offering is, Select Evidence. So Select Evidence is an expert cybersecurity assessment platform, and sometimes we refer to this as a consultancy as a service. So essentially what Select Evidence does is it performs a cybersecurity risk assessment for connected medical devices. It's very much a standards-based product, and it works in line with new regulatory expectations as set out by the FDA in the US. What this means for medical device manufacturers is that they now need to demonstrate that they have conducted a cybersecurity assessment of their product before their product gets into the market. And once their product is in the market, they need to be able to demonstrate that they're continuously monitoring that product for new vulnerabilities. And that's precisely what Select Evidence does. It automates that entire process. It allows a medical device manufacturer upload the software bill of materials of their product into our platform. Our platform identifies any associated vulnerabilities with the components of their medical device, and then it identifies the mitigations or the strategies for eliminating any associated risk. And it does all of this in a very automated fashion. So really the challenges that we are trying to overcome in the industry is the fact that there's a significant shortage of cybersecurity subject matter expertise in the industry. It's generally software and system engineers that are responsible for conducting these cybersecurity assessments. And so Select Evidence is there to fill that gap in terms of expertise and behave as an expert on site for our customers. So what that means for our customers is that Select Evidence allows them to perform the expert cybersecurity risk assessment, but doing that in a much more efficient time. So they can actually save 85% in terms of time with respect to performing those assessments in comparison to performing more traditional methods where they'd employ spreadsheets and monitoring, very, very labor-intensive monitoring mechanisms. And that's in the pre-market piece. And the post-market piece is where manufacturers need to continuously do that while the products are in the market. Well, Select Evidence actually performs even better there in that our platform will continuously scan the software bill of materials And once we identify a vulnerability associated with the medical device, it will fire off an email to the medical device manufacturers. And it's only at that point in time that they actually need to go back into the platform and assess what's actually going on with their device and then take further measures from there. So this is a list of some of our customers and partners. As you can see, we have our market strategy was to go in at tier one companies like Boston Scientific, Fresenius Medical Care. We've had great success with those companies. And we've also partnered with some leaders in the industry, such as Underwriter Laboratories, UL, and Microsoft. So that's it for me, if any of you have any questions.
Hi, Anita. Thank you for that. Thanks for that great overview of the amazing work that you and your company do. I guess I got a couple of quick questions for you. The first one is, the types of devices that we're talking about here. Am I right in thinking that this would be something like a connected pacemaker or connected insulin pump or similar devices?
Yes, absolutely. So anything with any connectivity, if it's wireless connectivity or if it's a device that's sitting on a network in a hospital environment.
And can you tell me a bit more about the problem here? I heard that hackers recently demonstrated how they could hack into a pacemaker. How big a problem is this in the marketplace?
So really where the problem stemmed from, we can actually say that innovation is a factor in this. We saw a huge surge in terms of technology innovation in the industry in the last decade or so. This was traditionally an industry of standalone devices. Very quickly and very aggressively, we saw more and more of these devices being connected to networks, wireless networks, IT networks. That provided a lot of benefits for patients and for caregivers and for hospital systems in terms of resources. However, taking those products that were traditionally standalone and putting those on a network, the safety considerations to do that and do that safely weren't actually taken into account. And what we now see is we have these devices, and many security researchers will actually tell you there are no connected medical devices that they cannot hack. These devices are there. They've opened up to a whole plethora of additional attacks, and namely cybersecurity attacks. So, the main concern in the industry, it's not necessarily that somebody's device is going to be attacked and that's going to be a form of assassination. Okay, that's an absolute possibility, but the major concern and what we're seeing quite a lot of in the industry are ransomware attacks, or where medical devices are seen as the weak link in hospital environments, and they're used as the launch pad for attackers to get in and take down networks. And that's the major concern here at this point in time.
And thanks for that. And is it true that with the coronavirus, that attacks, security threats and security attacks in general have gone up?
Absolutely. We've seen a surge. We've seen a surge over the last 6 to 8 weeks. Of course, this has happened in other industries, but it's extremely concerning when it's happening in the healthcare industry, and we're so much dependent on the healthcare industry cybersecurity posture holding up. But, I've read reports and I've seen articles around the fact that healthcare providers are so concerned with the cybersecurity issues that they're actually not connecting newly procured devices, namely ventilator systems. They're keeping them separate so they can provide treatment they do need for their patients without concerning themselves with cybersecurity. That's a quick fix. That's not really how this industry is supposed to work. We need to be able to depend on the cybersecurity of our posture, of our networks in the environment. And we need to know that we can connect these products safely and that there is no patient negative outcomes from that.
Wow, and that's a very, very serious problem, obviously. And I guess, in summary then, if I understand correctly, what you're doing is, if that's the problem space, what you're doing is you're really providing the software for medical device manufacturers to kind of understand these cyber threats and prevent them occurring to these devices before they launch them. And then you're kind of constantly monitoring for new threats every day. Is that right?
That's precisely it. And I'm with the last question you asked, Barry. I mentioned earlier about a project that we're currently working with Underwriter Laboratories, and it's very fitting to this particular coronavirus scenario. This new product that we're actually developing allows a hospital to evaluate the security of a product before they take it into their network environment. So this new technology, which we're calling Select Secure, automates the evaluation of a device for a given environment, and it reduces that procurement security process from about somewhere between 5 to 8 weeks down to literally minutes. So that in the event of a pandemic ever happening like this again, where we are relying on a healthcare system and procuring new devices into environments, this new product should eliminate the need for healthcare providers to use these devices but not connect them to networks to ensure patient safety.
Fantastic, and I mean that's an amazing application, and obviously from what you've said, badly needed at the moment, and it's great to see this rolling out to medical device manufacturers and hospitals as well. Can I ask you one final question? It strikes me that a connected medical device is really an Internet of Things device. It's a complex Internet of Things device. And so do you see application for what you're doing beyond medical devices?
Absolutely. We give consideration to all of safety critical industries. So as part of our growth strategy plan, we will look to autonomous driving, automotive, aviation. Those industries depend on the security posture of their products just as much as the medical device industry does. We're more behind in the medical device industry, but they're really trying to ramp up. But even more so to the point, and outside of just thinking about those critical industries, it's actually going to expand the need to harden and secure connected devices or IoT devices. It's going to expand across the entire array of industries. And this coming from the EU Cybersecurity Act, where it's looking like over the next 2 to 3 years, any product, any IoT product, any device that is connected will require certification. And this is why we're actually working with certification companies and why they have so much interest in Leah, because our product can actually provide traceability and visibility of conducting those assessments for certification and recertification of other devices.
Wow, Anita, thanks very much. I'll hand back over to you, Nick, but from what you're saying, this is badly needed software for the IoT sector in general and for medical devices in particular. Thank you very much, Anita.
Thanks, Barry.
Yeah, Anita, thank you for giving us that fascinating insight into Leah, and the company clearly has a very exciting future. So again, thank you and Barry for being with us today. Thank you.
Thank you,
Thank
Nick.
you, Nick. Cheers.